So what happens at high altitude? When you go to a high altitude place, like mountain, the air pressure at mountains is lower than at sea level. This is important because even though the percentage of oxygen in the air stays the same, about 21%, the actual amount of oxygen you breathe in decreases. I suppose that it sounds a little bit confusing to you, so let's illustrate this for a better understanding. So here we will compare what happens at sea level and in the mountains at high altitude. The root of problem here is barometric pressure. Barometric pressure is the pressure of all gases in the atmosphere. Don't look at oxygen here, probably I was drunk writing this. At sea level, barometric pressure is approximately 760. Let's depict this as gas molecules. So in total, we have here 7.5 molecules of gases. But as we go higher, barometric pressure decreases. Let's suppose that at high altitude, barometric pressure becomes 500. So in the mountains, the total amount of gas molecules is significantly lower. In this case, we have 5 gas molecules. The fraction of inspired oxygen is always 21%, whether you are at sea level or in the mountains. Basically, it tells us that among all gases in the atmosphere, the portion of oxygen is always 21%. For example, the portion of nitrogen is always 78%. It's two most common gases in the atmosphere. And knowing these values, we can calculate the actual amount of oxygen that incomes with each breath into our lungs. We call this value partial pressure of inspired oxygen. So if the total amount of gas molecules is 760, and oxygen share from this is always 21%, the amount of oxygen molecules that income into the alveoli with each breath at sea level will be 160. So simply speaking, to calculate oxygen, we take 1/5 of total amount of gas molecules in the atmosphere. Initially, inhaled oxygen incomes to alveoli, and from alveoli, oxygen diffuses into the blood, and the normal partial pressure of oxygen in arterial blood is approximately 100. In contrast to this, in high altitude, because the total concentration of gases in the mountain area is lower, the amount of oxygen that we inhale will be lower. In this case, partial pressure of inspired oxygen will be 105. So basically, it will be the difference in inspired oxygen between sea level and high altitude. The lower is the income of oxygen to alveoli, the lower will be the amount of oxygen molecules in the blood. And in this case, the partial pressure of oxygen in the blood will be approximately 60. So the reason why we have lower income of oxygen into our blood in the mountains is lower barometric pressure. Decreasing amount of oxygen molecules in the blood will lead to respiratory alkalosis, which is the crucial event in pathogenesis of altitude sickness. So let's break down this concept in details. So it's alveoli compartment and its blood compartment. Initially, let's take a normal state. At sea level, oxygen from the atmosphere incomes to alveoli. From alveoli, oxygen diffuses into the blood. The amount of oxygen molecules in the blood we measure by partial pressure of oxygen in arterial blood, and in normal state it's approximately 100. In the blood, oxygen is carried by the hemoglobin. In turn, hemoglobin is located inside the red blood cells. Red blood cells deliver oxygen with hemoglobin to the tissues. In the tissues, oxygen dissociates from the hemoglobin. And once oxygen is released into the tissues use oxygen for energy production. But at the same time, as a waste product, tissues release carbon dioxide into the blood, and the partial pressure of carbon dioxide in arterial blood is approximately 40. The major role of carbon dioxide in the blood is to acidify blood, and by this we can maintain our blood pH within normal margins, which is approximately 7.4. From the blood, carbon dioxide diffuses into the alveoli, and from alveoli we excrete carbon dioxide by exhalation. The income of oxygen into the blood and the excretion of carbon dioxide from the blood is stimulated by respiratory rate. So what happens in high altitude? We know that on high altitude, because of lower barometric pressure, the partial pressure of inspired oxygen is lower, which means that less oxygen molecules income to alveoli. With decrease in oxygen income to alveoli, the amount of oxygen molecules in the blood decrease. Let's suppose that at high altitude the partial pressure of oxygen is 60. This results in decrease in income of oxygen to the tissues, which will cause decrease in energy production. This state we call tissue hypoxia. And decrease in partial pressure of oxygen in arterial blood we call hypoxemia. In response to hypoxemia, our body stimulates respiratory center, because with increase in respiratory rate, the income of oxygen into the blood will increase, which to some extent can correct hypoxemia and tissue hypoxia. But at the same time, with increase in respiratory rate, carbon dioxide excretion increase, which will cause decrease in partial pressure of carbon dioxide in the blood. Let's suppose that on high altitude, carbon dioxide pressure decreased to 25. And with decrease in carbon dioxide, acidification of blood decrease, which means that blood becomes more alkaline. So let's explain why decrease in carbon dioxide causes increase in blood pH. When our body cells make energy, they produce CO2 as a waste product. This carbon dioxide in the blood doesn't just float around. It reacts with water in a reversible reaction with production of carbonic acid. Carbonic acid doesn't stick around long. It splits into the two parts, a hydrogen ion and bicarbonate. The key concept is that it's an equilibrium reaction, meaning it can go forward, making hydrogen ion and bicarbonate, or backwards, forming carbonic acid. It depends on the condition. The goal here is to keep our blood pH stable. To see how carbon dioxide affects blood pH, we use Henderson-Hasselbalch equation. It shows how pH depends on bicarbonate and carbon dioxide. Let's put into this reaction normal values. We know that bicarbonate concentration in the blood is approximately 24. Normal partial pressure of carbon dioxide in the blood is 40. The reason why we multiply carbon dioxide pressure on 0.03 is that we are interested only in dissolved carbon dioxide, and 0.03 is the solubility coefficient of CO2 in the plasma. By this, we basically convert pressure into the concentration, and if we calculate this, the result will be 7.4, which is actually our normal blood pH. Now, let's put normal values into equilibrium reaction. So, the concentration of carbon dioxide in the blood will be 1.2, and normal bicarbonate concentration in the blood is 24. So, as you see, we have huge bicarbonate reserves. The concentration of bicarbonate, in fact, is 20 times higher than the concentration of carbon dioxide. And it's crucial because now we understand that even small changes of carbon dioxide will have dramatic effects. But because bicarbonate concentration is huge, changes in bicarbonate concentration will not have this dramatic effect. Now, what happens in high altitude? We know that in high altitude, due to the activation of respiratory center, the partial pressure of carbon dioxide in the blood decreases and becomes 25. So let's put this 25 value into both our formulas. If partial pressure of carbon dioxide becomes 25, the concentration of carbon dioxide in the blood becomes 0.75. So previously at sea level, the concentration of carbon dioxide was 1.2 and now it's 0.75. The difference is 0.45. To compensate this difference, we use our bicarbonate reserves. Basically, we convert a portion of bicarbonate into carbonic acid, and after, carbonic acid splits to carbon dioxide and water. So now the concentration of bicarbonate will be 24 minus 0.45, which gives us 23.55. Let's put 23.55 bicarbonate concentration into the pH formula below. So at high altitude, the concentration of bicarbonate decreases and becomes 23.55. And now, as we calculate this, the blood pH will be 7.6. And this condition we call respiratory alkalosis, because we have alkaline state in the blood, and the causative factor is decrease in partial pressure of CO2 due to the high respiratory rate. For exams, we have to know that we can correct respiratory alkalosis by prescription of acetazolamide. Let's explain why. Acetazolamide increases the excretion of bicarbonate, and in the same time it decreases the reabsorption of bicarbonate by the kidneys. So acetazolamide can decrease the concentration of bicarbonate in the blood. Let's suppose that bicarbonate concentration decreased to 18. And now, if bicarbonate concentration decreased to 18, blood pH will become 7.48. So, as we see, it can somehow correct alkaline state. Once respiratory alkalosis develops, it can cause clinical symptoms. And we roll these symptoms into the one term, which is altitude sickness. So let's illustrate this in our pathogenesis. So at high altitude, with decrease in CO2 concentration in the blood pH increases and becomes 7.6. This condition we call respiratory alkalosis. And alkalosis leads to so-called altitude sickness, which manifests as headaches, nausea, fatigue, lightheadedness, and sleep disturbances. Another pathological manifestation of hypoxemia is pulmonary vasoconstriction that leads to pulmonary hypertension and right ventricular hypertrophy. So let's explain these two events. With hypoxemia, our pulmonary vessels constrict. First of all, we have to recall that the blood flow through the pulmonary vessels is equal to pressure difference divided on resistance, and resistance is inversely proportional to the force power of radius. So, with hypoxemia-induced constriction of pulmonary vessels, their radius decrease. With decrease in radius, resistance increase, and with increase in resistance, blood flow decrease. With decrease in blood flow, more blood stays in the pulmonary vessels. And we know that with increase in volume of blood, the hydrostatic pressure of blood inside the pulmonary vessels increase, which will cause pulmonary hypertension. Also, with increase in resistance in pulmonary circulation, it will take more effort for right ventricle to push blood through the pulmonary vessels. And increase in workload on right ventricle will cause hypertrophy of the right ventricle. As a long-term adaptation mechanism, in response to hypoxemia, our body increases the production of erythropoietin. Erythropoietin stimulates bone marrow to produce more red blood cells with hemoglobin. By increasing the amount of hemoglobin in the blood, we increase oxygen carrying capacity, which can to some extent correct hypoxia in tissues. And the last feature how our body adapts to hypoxemia is increase in oxygen dissociation due to the increase in 2,3-bisphosphoglycerate. With increase in amount of 2,3-bisphosphoglycerate, hemoglobin affinity for oxygen decrease, which can increase oxygen dissociation from hemoglobin. And the higher the oxygen dissociation, the more oxygen molecules will income to the tissues, thereby correcting tissue hypoxia. Because it's a very popular question on examinations, let's explain this mechanism in details. So here we have simplified hemoglobin structure. There are 2 alpha and 2 beta chains. Each chain has iron with +2 charge. Each iron with +2 charge can bind 1 oxygen molecule. So in total, hemoglobin can bind up to 4 oxygen molecules. If hemoglobin has just 1 oxygen molecule, we say that hemoglobin saturation is 25%. If hemoglobin carries 2 oxygen molecules, its oxygen saturation becomes 50%. 3 oxygen molecules give saturation 75%. And if hemoglobin has 4 oxygen molecules, it's 100% saturated hemoglobin. The most important feature about hemoglobin is that hemoglobin is allosteric protein. It has positive cooperativity in relation to oxygen. First of all, what is an allosteric protein? An allosteric protein is one whose function or shape changes when a molecule, like oxygen, binds to it. This change affects how it interacts with additional molecules. Hemoglobin exhibits allosteric behavior when hemoglobin binds oxygen. This means that the binding of one oxygen molecule to one subunit enhances the binding of oxygen to other subunits. So, because hemoglobin is allosteric protein, if one oxygen molecule binds to hemoglobin, it causes a conformational change in the hemoglobin molecule. This change makes it easier for the remaining subunits to bind additional oxygen molecules. In smart words, hemoglobin affinity to other oxygen molecules increases, and because the binding of one oxygen molecule enhances further oxygen binding, we call this phenomenon a positive cooperativity. We have to know that the only thing that can force hemoglobin to give away oxygen is decrease in partial pressure of oxygen. Partial pressure of oxygen is basically the concentration of oxygen molecules. The lower the partial pressure of oxygen, the more rapid is oxygen dissociation from hemoglobin. For example, with partial pressure of oxygen 100, the dissociation is 0. Hemoglobin gives away the first oxygen molecule only when partial pressure of oxygen becomes lower than 40. The dissociation of 2 oxygen molecules occurs only with partial pressure of oxygen lower than 26. And 4 oxygen molecules dissociate only with partial pressure of oxygen near 0. And now, knowing this, we can discuss oxyhemoglobin dissociation curve. So here is partial pressure of oxygen, and here is oxygen saturation. For comparison, let's suppose that without positive cooperativity, partial pressure of oxygen and oxygen saturation have linear relation. And this purple curve is how oxygen dissociation occurs in real life due to the positive cooperativity. In oxygen saturation, we are interested only in points where hemoglobin gives away oxygen. So it's a point where hemoglobin loses 2 oxygen molecules and becomes 50% saturated, a point when hemoglobin loses first oxygen molecule and becomes 75% saturated, and loss of 3 oxygen molecules make hemoglobin 25% saturated. We have to know that our tissues have partial pressure of oxygen between 20 and 40. So this red area is where hemoglobin should drop oxygen molecules. And it's vitally important for hemoglobin to drop oxygen precisely into this area and not earlier, because otherwise tissues will not receive oxygen. If tissues need oxygen, we need to increase the dissociation of oxygen from the hemoglobin. To increase oxygen dissociation, we have to inhibit positive cooperativity, and this will force hemoglobin to share its own oxygen with the tissues. In settings of high altitude, hypoxia provokes increase in respiratory rate, which in turn leads to respiratory alkalosis. With alkalosis, increase in pH provokes increase in 2,3-bisphosphoglycerate, which inhibits positive cooperativity. So 2,3-bisphosphoglycerate make a hemoglobin-oxygen link weaker, which allows oxygen to run away from hemoglobin at a higher partial pressure of oxygen level. Well, if positive cooperativity will decrease, hemoglobin will give away oxygen more willingly, which means that hemoglobin will give away oxygen earlier at a higher level of partial pressure of oxygen. That's why the curve will shift to the right. What is the purpose behind this? Let's take a moment when hemoglobin will give away the first oxygen molecule and will become 75% saturated. Hemoglobin delivers oxygen from the lungs, which have partial pressure of oxygen 100, to the point where partial pressure of oxygen will force hemoglobin to give away the first oxygen molecule. With normal affinity of hemoglobin to oxygen, it's around 30. But if factors that we mentioned earlier will inhibit positive cooperativity, the affinity of hemoglobin to oxygen will decrease, and now hemoglobin will give away oxygen earlier at a higher partial pressure of oxygen level. Let's say it's 40. So before, the distance of oxygen transportation by the hemoglobin was 100 minus 30, which is a distance from the lungs to a point of dissociation, and in this case it's 70. Let's suppose that the speed of oxygen transportation by the hemoglobin is 10 millimeters of partial pressure of oxygen per minute. So the time of one oxygen molecule transportation will be 70 divided on 10, which give us 7 minutes. So in this case, it takes 7 minutes to deliver one oxygen molecule from lung to tissues. But with right shift, the distance will be 100 minus 40, which give us 60. The speed of oxygen transportation by the hemoglobin is the same. So now the time will be 60 divided on 10. So with right shift, it takes 6 minutes for hemoglobin to deliver one oxygen molecule to the tissues. Based on this, we can say that the right shift allows us to transport oxygen to tissues significantly faster. So right shift is an adaptation mechanism that becomes very useful in case of tissue hypoxia, because it allows to increase oxygen delivery to the tissues. And the last adaptation mechanism is increase in amount of mitochondria in tissues. Increase in amount of mitochondria allows tissues to significantly increase oxygen uptake, which can boost energy production. Hope you like the video. Press like and hit subscribe button. And may the force be with you.